Namaste, I'm Dr. Sigdel. Today I'll discuss passion autonomy. Let's discuss together. This is the passion right. Grand, competent adult, the right to make their decision on own health care. This is given as a uh, their any kind of decision in their body should be decided by their own. This started the Society of Newark Hospital, 1913. Okay. Performing without surgery, performing surgery without consent. This is almost assault. We cannot do surgery without consent. So, what are the inclusion here? They can refuse the treatment, even it's beneficial. Let's discuss some point here. Somebody want to do surgery, okay, cesarean section. They know mean patient refuse cesarean section, even it is indicated. That is the point. Refuse is very, very important. This happened in the experiment too. I wish honor even if capacity is later lost later. Yeah. See, look here. Wish honor even if a capacity is later lost. That is the point. Autonomy always supersedes beneficence, except when there is potential harm to innocent third party. Okay, patient may make wrong choice. Doctor cannot override autonomy over beneficiaries alone. Let's talk about competence and capacity. Competence is a legal determination by court. Competence, legal determination by court. It is decided by the court here. Understand? But adult presume competent until proved otherwise. All adults will be competent, but this is determined by the court. Capacity. Capacity, medical determination by physician based on understanding and memory, reasoning, and judgment. Core factor here understanding, memory, reasoning, and judgment. Minor. What is the age of minor? Less than 18. You should remember this one. Okay. This is the 18. Usually require parental consent here. But some situation, this is not require parental consent. One, life-threatening emergency. There, no parental consent. First treatment come. Partial emancipation scenario, prenatal care, contraception, STD, and substance abuse. This no required of parental consent. Emancipated minor can make all healthcare decisions independent. What are these groups? They may prenatal care, contraception, STD, and substance abuse. Suicidal patients often lack capacity. Psychiatric mentally disabled patient may retain the capacity to refuse treatment. Two line here, very, very important. We have to understand suicidal patient. They lack. If somebody want to suicide means they don't have capacity to suicide. But psychiatric and mental ill patient, what happens is they still have the capacity. Maybe they want treatment or refuse treatment. We have to take the consent. Next topic is informed consent. What is informed consent? Must describe all options, risks, alternative, consequence of the treatment, of the refusal in understandable language. Language should be very clear here. This should be mentioned risks of the treatment, alternative of the treatment, and consequence of the treatment. Here you can see consent is procedure specific, cannot presume for other intervention. Let's say One patient went to the appendectomy. He gave the consent for the appendectomy. Now, while doing the appendectomy, there we see the tumor. We cannot remove and take biopsy from there. That is the this line say, okay, emergency consent implied if patient cannot provide it. Implied consent unless pre-existing do not resuscitate order. Consent is best obtained by whom? Intern? No. Resident? No. That is performed by performing physician. Consent should be taken physician. Physician able to understand consequence of the treatment, complication of the treatment, side effect better than any fellow or resident.
For life.
Telephone consent, yes, there is a issue, but valid with surrogate with witness. Pregnant women can refuse therapy. I already mentioned pregnant women can refuse therapy, even risky fetus. Father consent not required. Here, important point, pregnant lady can refuse treatment. Other is father consent valid? No. So here we discuss almost autonomy. Uh, Thank you for the today's session. Thank you.